Welcome to the Therapist Uncut podcast, where off-the-clock therapists who happen to be friends share their uncensored thoughts about real life. Join us weekly in spreading positivity and making mental health relatable through casual conversation, inspirational stories, and real talk with friends who happen to be therapists. Please welcome your co-hosts, Nikki Young, Jolene Daly, and Alyssa Nahara.
Welcome back, everybody. It's another week of Therapist Uncut. Nikki here with Alyssa and Jolene. And today we are talking about a topic that's a little heavier, I think, than some of our typical content, but we're talking about cancer. And cancer fucking sucks. And a lot of us have personal experience with cancer, or we have seen it in those around us. So we just wanted to take a minute here and give some time to a topic that's very important.
We have an amazing listener who sent us a video, Sherry Keener, to share with you all about her journey and a little message to go along with that.
Hi, my name is Sherry, and I'm here today to share with you the importance of prevention and early detection of breast cancer. I know you've heard about self-examination. I heard it many a time, but I rarely checked for abnormalities. When we did discover a lump, I didn't address it right away as I was caring for my ailing mother. Once I did schedule a mammogram, a biopsy and surgery soon followed. I was diagnosed with invasive ductal carcinoma. I had a partial mastectomy of my left breast in the summer of 2015. Weeks after surgery, the incision opened up and a wound vac was required to help me heal. This delayed things a bit, but I would eventually have 30 sessions of radiation therapy. I had 3 small dots from that experience, so I guess you could technically say now I'm tattooed. Remember to listen to your body and take care of yourself. Regular examinations and screenings are the key to maintaining good health. Should you find yourself in a situation where you too become a warrior against cancer, know that you are not alone. Surround yourself with a great support team. Don't be afraid to ask your doctors to explain anything you don't understand, and utilize whatever services or therapies that are made available to you. A simple massage can take away stress you may not even realize you have. I've also participated in paint therapy. I encourage you to try the services and activities that may be offered at no cost to you, the patient. Fortunately, the timing of my diagnosis allowed for my husband to drive me to each radiation appointment and to most of my medical appointments. I had the best group of friends, family, and friends that are like family pulling for me through that whole experience. I thank my Lord and Savior for bringing me through, and I can say I'm now breast cancer free after being NED, otherwise no evidence of disease, for 5 years. Thank you for letting me share my journey with you. Remember, take care of the girls.
I wanted to applaud at the end of that because she's been cancer free for 5 years. Those are the greatest words for people to hear, right?
Right.
Mm-hmm. 2 aspects that she hit on that I love. One, she talked about the emotional impact of a cancer diagnosis. And then she also talked about her support system around her.
2 huge areas that you have to really make sure that you recognize is that support system. Whether it's family or medical, it's really important. I've met a few really great offices that work for people or work with people who have cancer. And so it's important to find the right office for you.
And that's a big one.
Yeah, Sherry really highlighted the importance of taking preventative measures and meeting with your doctor and asking questions. Unfortunately for her, she talked about catching it in a timely manner that allowed her to get the treatment that she needed. So we definitely recommend to make sure you're staying in contact with your doctor and taking care of your medical care. We talk about self-care. We've talked about it in the past, but self-care also includes going to the doctor, getting your regular checkups, and taking care of any of those preventative health things that you need to make sure you make a priority.
Because it's so easy to let that slide. And I will throw myself out there as a horrible example of routine healthcare. I'm not good at it, and I've had to get better at it recently.
And we wanted to provide you guys with this episode this month because it is October. It is Breast Cancer Awareness, and this is our bonus episode for you guys this month. But cancer in itself, we know it's not just breast cancer. It's not just colon cancer. Cancer takes so many forms, and more likely than not, it has touched every single one of you in some capacity, whether it is somebody in your family, whether it is you, somebody close to you. It's everywhere. So we really felt like it was important to take time to really talk to you guys about this topic today and maybe share some tips that might be helpful to help you cope with if you or somebody you know is diagnosed with cancer.
This is one of those areas where it's really important to continue to talk about mental health and making it relatable to everyone. Because when you're going through a cancer diagnosis, whether you're the patient or the family or the friend, you need support. That may not necessarily be professional support. It could be a support group. It could be just getting together with the family or the patient. There's a lot of different ways that that could be viewed for a specific individual. You have to know you and what you need.
Sherry talked about paint parties, right? Or paint therapy. That was a beautiful way to help her cope with this entire process, because not only is it the immediate shock that comes with the diagnosis, but it's now processing all of that and working very likely through the stages of grief that we've talked about in past episodes and going through the treatment. The treatment is so incredibly physically and mentally and emotionally exhausting. And that support is going to be key to help you get through it.
It's complicated too, right? So for that individual, let's say being active is how you typically cope with stressors, going to the gym, doing yoga, those types of things. Sometimes you're so sick during cancer treatment that your previous forms of self-care and coping, you can't do them. It's very easy in that time to kind of lose your connection to healthy habits, at least in terms of emotional self-care. Because who has the energy to figure out new ways of taking care of yourself when you're also figuring out how to stay alive?
That's the reason to get that support, because one of the things that you can do, you might not be able to do physical stuff, but you can absolutely do mindfulness. So I don't know who would want to, but you might want to visualize yourself running through the mountains.
We know that visualizations aren't everybody's cup of tea, but
Yes.
it's an option. Consider trying it.
I was actually more the running part. I don't know that I'd want to even visualize myself running.
But Nikki hit it spot on, right? There are going to be some things that we are used to doing as individuals that are going to be impacted. Our day-to-day functioning is going to be impacted. Our fatigue levels are going to go up. We might be very physically nauseous and sick. We can't do the things that we used to do. And that's really hard for people to work through. And they can get really down on themselves and get stuck in their head about all the things that I can't do anymore and how this is screwing up my life. And it very much is life-changing, but there are supports out there available to help you through it.
And let's talk about the family, because, or the friends, those, your close circle that is going through this with you. When somebody's loved one, receives a cancer diagnosis and goes through that treatment process, it is so easy for the family to not take care of themselves because your whole focus often becomes taking care of that person. But it's a terrifying time. It's an exhausting time. It is oftentimes with cancer, family members and friends become caregivers. And so it's just a whole dynamic that can wreak havoc on somebody's emotional state. I need to take this time to go care for me. Even, I'm sorry you got cancer. Like, we don't want to take care of ourselves in those moments. Oftentimes we want to focus on that person, but how do we balance that? How do we take care of our own emotional reactions, our own grief process in regards to that diagnosis? Maybe that person is terminal. How do we manage that?
We've talked about that in the past. You have to take care of you before you can take care of anyone else. And that includes in this situation with caregiving and a parent or a family member or a friend with a cancer diagnosis. You have to take care of you. What that looks like may be different. Sherry talked about the individual knowing themselves and knowing their body. It's important to kind of listen to your body. That's also important for the caregivers, the families and the friends.
It's so easy to be consumed by this news and by the treatment process, and seeking professional help, seeking a community of support that's going to understand what you're going through, that can be very beneficial for you. So we really encourage you guys, especially if you find yourself in the caregiving role, to be reflective in how you're taking care of yourself. Make sure you are making your routine healthcare appointments and you are sleeping and eating, because it is very easy to skip meals and be really fatigued. So practice that self-awareness and self-care for you too.
let's see, you hit on it, and I can't remember exactly how you phrased it, but finding people who understand what you're going through, because there's a whole cancer culture, right? There's a cancer culture for survivors and for people who are living with cancer, but there's also maybe a less talked about, but there's a cancer culture for those who have walked through it with someone. And it's not necessarily something that you understand if you haven't been there. So, and oftentimes we're very good at being there for other people, but for somebody who's experiencing something traumatic or frightening or terrifying or icky, cancer's just it's horrendous. Sometimes you feel like you just need that connection with somebody who gets it.
Sherry said, "You're not alone." And that is the truth, because it can feel so incredibly isolating when you're going through this process, either as a survivor or a caregiver. And you have to remember that you're not alone. So do look for ways to find that community for you.
So you're not alone. Who Let's just pull the three of us here. Alyssa, Jolene, who's had a experience personally with cancer.
Personally,
No, like within our
oh,
Oh,
a
yes.
loved one, or
Correct. We're all
Right?
raising our hands, guys, if you cannot see us.
I don't like
Who's
that
had an ex-
statistic.
I know.
I know. And let's go further. So you guys both raised your hands. We've all had a loved one experience cancer. How many of you have had multiple loved ones experience cancer? So all of us. I mean, I could speak for myself personally too, and something I have always said is I've gotten good at death. Like, I'm good at it. And it sounds strange to say, but it's the only way I can put into words my experience with it. Is I got good at it. I got good at people getting sick with cancer. I got good at the process. It's not saying it's easy, but it's a weird way to say it, but I got good at it because everyone in my family, it seems like, has experienced it. That's an exaggeration, but the percentage is quite high.
That's where I want to encourage everybody. Call on your support system. Call on your extended support system. So whether you're the individual patient or whether you're a family member, as a family member, I've called on my own friends who have nothing to do with specific family, and my friends have stepped up, sometimes even stepped up for my family. You need a huge support system because everybody's going to get exhausted. Sherry talked about, I think, the 30 radiation treatments that she went through. I believe those are done on a weekly basis and multiple times a week. So what happens if she doesn't have somebody that can drive her? That's 10 weeks. If she did 3 sessions a week, that's 10 weeks. That's a lot for one person to commit. She was lucky and her spouse was able to do that. That might not be the case for some people.
And we talked about drawing on your support system, and I could attest to that. I know large Greek family, everybody stepped up. Friends, I've spoken in earlier episodes about my friends or my family. That's just kind of how I operate, and everybody, Jolene, like you described, steps up to help you, to help your person, all of that. But what about people who don't have that built-in support system?
There are, in our area, there are several external support systems. So programs that are run by different organizations or nonprofits that can step up to help you as well. You just have to reach out and ask. Most of the oncology places, the places that you would get radiation or chemo, I would hope have that information. Your doctor would have that information. Reach out to those. Reach out to communities, to community organizations to let them know, hey, we need this. We're lucky in our area, and I don't know if it's multiple areas, but definitely our area. We have shout out to Chemo Crew. They are amazing when you have to go through chemo. They bring you a nice little basket because they have been through chemo, so they know exactly what you need when you're going to go through chemo. So they're there to provide you support, and they can provide you more than just that basket if you ask and talk to them.
And most areas, I know we have at least 2, I think, local agencies in this area that provide hospice support, but most areas are going to have some form of a hospice organization. And whether or not you meet criteria for their services, my experience, at least with them, is that they often will have a wealth of knowledge in this area and be able to send you different directions, including like Chemo Crew, that kind of thing. they're the experts in this. This is what they do day in and day out. So they're oftentimes more connected to the resources than you may be otherwise.
They get it. They know what you're going through. They have lots of experience. They just need you to call or contact them. Don't be scared. They're not scary in any way, and it can't be hard. But if you have supports around you, which you very likely do, just get past that barrier of whatever you're struggling with and contact them to find out what resources are available.
And while the person itself or the organization may not be scary, I mean, unless you get a Karen that happens to work there or whatever, but it is scary to make that call. You know, can think back to personal experiences with family members where they put off making those calls until, way too far into the process, because making that call meant I'm acknowledging that I have cancer. I'm acknowledging that I have a dire diagnosis, and it is scary. Oftentimes, not for everybody. Some people are like, yeah, let me get connected. Let me get what resources I need. But for a lot of people, it's that's a barrier.
I've also seen a lot of cultural barriers from just not even maintaining regular health care, in the sense of, if I don't call, if I don't go to this doctor's appointment, I notice these things on my skin, I notice these changes on my body, but if I don't get it confirmed by that doctor, I can deal with it. I don't want to know what it is. Don't tell me.
Mm-hmm.
But there are so many preventative services out there to help support us through that, and so much treatment available to help support us through many. I'm not going to say all of these cancers, but to support us through the treatment of a lot of these cancers. And so, Nikki, I was like, are you talking about my dad? Not that my dad was ever diagnosed with cancer, but he is one of those guys that's like, I don't want to know. I'm not going to go.
Yep. And it was a cultural thing that I was talking about too, right? It was one of my grandparents, and there was definitely a barrier to accepting it, definitely a hesitation, because if I just kind of pretend this isn't happening, everything's going to be okay. And it's not always the case.
I also want to shout out to the providers out there who are a part of the teams to care for cancer patients and who provide these resources, because you guys are exposed to this on a daily basis. They're exposed to the trauma of all the trauma that the families are dealing with and the patients are dealing with, and they are very much in a helping profession that is a very high stress position. So thank you to all of the providers out there that are constantly providing treatment and support to this fight against cancer. But also a reminder to you, there's resources for you too, to make sure that you can be in the best place emotionally and mentally to do the job that you need to do for all of these people.
Heck yeah. I mean, let's just think about everybody that works in the oncology field for a minute, because these are providers that they know that I don't know what the percentage is, but a percentage of their patients are not going to make it. I mean, that's like, just for us, let's think about that for a second. That's like being a therapist working with a population where you know that after you've spent all this time getting to know this person and trying to help this person, they're going to die. I mean, I just saw Jolene take a big, deep breath, because that's, there's trauma in so many aspects of the medical field, right? You're an emergency room physician, you got fatalities coming, all that, and it has an effect. But there's, I think, a difference with oncology in that you're with this person from the start of treatment, often all the way through this process. You get to know the person. I mean, you're invested in trying to help them heal, and oftentimes that's not possible, or depending on the diagnosis and the stage and all of that. But that's heavy. I mean, I've lived through this with multiple family members, and the outcome has been death in many of these instances, and I can't imagine doing that as a profession. That would just, shout out, you guys rock. You guys are so very needed, so very appreciated. So thank you for.
So good addition here is, you providers out there, make sure that you're getting your support and your help for your mental health as well, because I'm over here shaking my head thinking about that. That's not my area where I would want to be. So thank goodness I did not become like an oncology nurse or anything along that lines. Really a nurse in general, to be totally honest, not me.
What? Bodily fluids, what?
So you have to make sure that you get your support as well as the providers. I want to add one more thing. I want to give a huge shout out to those tattoo artists. I'm not a huge fan of tattoos. I have a couple, but it's not like huge. I think it's amazing to have those tattoo artists that are willing to help, whether it's typically, I think it's breast cancer patients when they have mammograms. They're willing to design these amazing mastectomies.
Mammogram. There you go.
See, not a doctor. When they have mastectomies, they're able to design
get the girl squish.
beautiful murals.
Yeah.
However, I understand that they'll do other scars as well. So they'll design things around other scars. So,
Part of helping that person in their healing process.
Right.
Right. And accepting the body that, yeah, definitely.
And that's
so
one of
yes,
those
definitely save the
communities,
tatas and get your mammograms.
But preventative in all aspects, right? And I'm going to offer myself up again here as a perfect example for not putting things off. And Alyssa said, it's so easy to see something and brush it off. It's whatever it is. I had something on my chin for the longest time, just didn't really pay attention to it. Honestly, didn't realize what it was until all of a sudden I did. And I had let it go way too long. And it was, I don't want to say just skin cancer, but it was just skin cancer, not the kind that is typically life-threatening or anything, but it did result in a giant chunk of my chin having to get cut out. And you can't really tell so much from this distance from the camera, and the surgeon did a fantastic job. But I mean, I have a scar that goes from the center of my lip up top all the way down and around to the bottom of my chin. And, by the time they were done excising everything, I had a giant hole. And so the surgeon was fantastic, but the hole in my chin was quite large. And it is a very unsightly scar on my chin. Significant family history of cancer. As I mentioned, I have now had the skin cancer at a young age. So I've had several other areas that have had to be checked and ongoing. It's an ongoing issue. So what I've told my family is I'm going to be so full of scars in the next few years that I'm going to have to get ripped so that it's like a sexy thing, and not just covered in scars. So I ordered a gym for my garage, guys.
Cool.
Yes,
Yeah.
and we support you in that journey, Nikki. And we want to take the time to thank Sherry again for putting that video together for us. We really appreciate your story and being vulnerable and willing to share that with all of us. And as a reminder from Sherry, make sure you guys get checked and find things that support you. It's because you're not alone.
You guys rock. Everybody out there who's listening to this, who's experiencing cancer, whether it's yourself or a loved one or you're treating cancer, you guys rock.
Thank you so much for allowing us into your lives for this bonus episode for October Breast Cancer Awareness Month. And we will see you guys next Monday on Therapist Uncut.
Thank you for joining Therapists Uncut, a production of AMP Smart Business. To learn more about Therapists Uncut and stay up on upcoming episodes, please subscribe and follow us on social media. As a reminder, although the Therapists Uncut co-hosts are licensed therapists, they are not your therapists. This podcast is not intended to substitute professional mental health counseling. If you need professional therapy, please contact your local provider or primary care provider. Thanks for listening, and we'll see you on the next episode of Therapists Uncut.